Hello everyone. Today in this video we will be discussing about Portacath device. Myself Anusha Anand, working as a tutor in M College of Nursing. Objectives. At the end of this section we will be able to define Portacath, explain the placement of a port, enumerate the purposes, enlist the indication, discuss the benefits and risks, mention different types of port, describe Port-a-cath Flushing and Port-a-cath pillow, and summary. Introduction. Some forms of medical treatment such as chemotherapy require people to receive frequent doses of intravenous therapy over a long period. A Portacath is a small piece of medical equipment that can make this procedure simpler for healthcare professionals and more comfortable for patients. As its name suggests, a Portacath is a combination of a portal and a catheter. Some people refer to Portacath as ports. Definition of Portacath. A Portacath is a device that is usually placed under the skin in the right side of the chest. It is attached to a catheter, a thin flexible tube that is threaded into a large vein above the right side of the heart called the superior vena cava. A Portacath is used to give intravenous fluids, blood transfusion, chemotherapy and other drugs. It is also used for taking blood samples. A Portacath may stay in place for a long time and helps reduce the need for repeated needle stick. Let's see the placement of a port. The port is usually placed on either side of the upper chest below the collarbone. In general, the preferred veins for central access are the right internal jugular, left internal jugular, right subclavian and left subclavian in that order. However, the doctor will determine where the best placement of the port is depending on what is best suited for a patient's treatment. Purposes of Portacaths. Ports can be useful when people need frequent IV treatments over a long period, such as for chemotherapy. Repeated IV treatment involves a lot of needles, which many people find uncomfortable. It can also be challenging for healthcare staff, who sometimes have to spend time searching for veins. Inserting a Portacath removes these issues as it establishes a direct pathway into the person's vein. Healthcare professionals can also use a Portacath to draw blood for lab tests. Research has shown that Portacaths are a safe option for children with chronic disease. Indications for a Portacath. A Portacath provides reliable vascular access for patients requiring long-term chemotherapy, those who need antibiotic, parenteral nutrition, fluids, pain management and frequent transfusion of blood or blood products. Benefits of using a Portacath. A Portacath be very beneficial for the following reason. Alternative to needles. Portacaths bypass the pain and potential risk of using needle stick for every treatment or blood draw. Low infection risk. Portacaths carry a lower risk of infection than other IV methods. Easy care. People generally find that they are simple to care for at home. Long duration. Portacaths stay usable for a long time. Hidden appearance. Portacaths are not noticeable as they sit under the skin. Risks. Portacath can be very beneficial and the risks are not common. However, they are not risk-free. The potential hazards of Portacath include local infection and clots. Local infection. The skin around the insertion site could become infected and need antibiotics. Clots. If a clot develops in or around a Portacath, doctor use blood thinner to remove it. Different types of Portacath. The different types of Portacath include single lumen, double lumen, power port. Single lumen. The most common type of port. This helps people getting only one form of IV therapy at a time. Double lumen. This type is helpful for people who are getting two forms of IV therapy at the same time or need to receive infusion or nutrition during treatment. Power port. This type is strong enough to work with high pressure injections such as those for a CT scan with contrast dye. Port-a-cath Flushing. Flushing is a term that describes a maintenance procedure for making sure that a portacath remains free of clots or blockages. It also helps prevent complications. Once inserted, a person can flush the portacath, which involves rinsing it in a saline solution and blood thinners. Recommendation for the frequency of flushing vary. A 2014 study involving 293 cancer patients showed that flushing every 90 days was safe. Portacath pillows. A portacath can make the process of receiving IV treatment less uncomfortable. However, it cannot make the process of getting to and from those treatment more comfortable, and that is where a portacath pillow or port pillow can be beneficial. Seat belts can hit and irritate a portacath's insertion point. A portacath pillow attaches to a seat belt and protects that area of the body. A portacath pillow are often handmade. People can use these instructions to make one. Now let's see the summary. Portacaths are small mechanical devices that make IV treatment less painful for those receiving it and easier for healthcare professionals to manage. Instead of searching for a vein and using a needle stick every time an individual receiving IV medication, healthcare professionals give treatment via the Portacath. They can also use Portacaths to draw blood. Portacath can stay in the body for 2 to 6 years, and they offer many benefits compared with some other IV line alternatives. They carry very few risks and can make a person treatment less painful. Hope this video is beneficial. Thank you.